And I love this one. Perfect. Bump. She's just sitting, eating her chocolate. This is what not to do. Give this to your patient. Say, this is what you don't want to do. You know? What's that? Okay, so your diabetes nursing diagnosis. So your patients who have diabetes, they can have any number of these nursing diagnoses. High risk of injury. Now, when we say use the diagnosis risk for injury, that could be anything. It doesn't mean that it's just physical, because they could be injured by the disease process. You see what I'm saying? So you can use that, but be specific about it. That's reflective of your patient. Goal, maintain fluid and electrolyte balances. So this is a good visual too, in terms of, what did we say? They have diabetes, so they need to check their blood sugar, take their insulin, they need to watch their salt. All of that is very helpful. So these are good teaching tools, I think. You certainly can print these out and issue them to your patients because guess what? You have to teach. NCLEX wants to know that you're teaching your patients. These are good teaching tools. That if you have a diabetic patient, and I'm gonna go out on a limb and say, before you finish the program, you will have taken care of diabetic patients, because they're there. They are, what do we call it? Revolving doors. They come in all the time, and you're gonna be teaching them the same information every time they come. And hopefully one of those times they get it. Okay? When and how often should I be testing? Well, if they're on insulin, they probably should be testing 4 times a day. Because when they're in the hospital, the physician's order is probably gonna say QAC and HS. What does that mean?
Before eating and night.
Before meals and
You're close.
blood sugars before meals and bedtime.
That is correct. Thank you, sir. QAC, AC, you gotta learn your abbreviations. AC is before meals. So that means before each meal, their blood sugar should be taken. And then based on what that is, determines if we give them coverage, which is gonna be your insulin. And then at nighttime, they should know before they go to bed, because maybe they need a snack before they go to bed, okay? Not on insulin. If they're not taking insulin, maybe they're on oral, then probably it's gonna be 2 times per day that they need to check their blood sugar. But again, the order will come from the physician. But this is just in general. Because sometimes patients say, well, I don't know how frequently. Well, if they haven't been told by their physician, we can at least say this. If you're taking oral, you should take it at least twice a day, okay? This slide kind of looks at meal plan that kind of works like this: breakfast, lunch, and dinner. Well, you want them to be balanced. That's what we want. We want that balance across the board. Okay? Now, there is such a thing as, when it comes to the diet and meal planning, they can do trade-offs. They can trade one type of food for another. What am I saying? What's an example?
Substitute.
Anyone?
Like regular milk for almond milk?
Well, a little bit more specific than that.
And they can do bananas instead of something or.
Right, something, so if they have for breakfast, and they have something that might increase that blood sugar, that they really have a taste for, see, we have to teach them this because then they might do better with their diet. But then come lunch, so you can exchange, it's called an exchanging. So maybe for lunch, you don't have, yeah, you might skip dessert. Well, I had this for breakfast, my blood sugar went up, so for lunch, I won't have any dessert or anything that will have it. So you're exchanging, and that's okay. I think it's like, if you tell them it's like being in Las Vegas, you know, with their foods, you get the, oh, I meant to say take care of their cell phones. Okay, so how to care for yourself when you're hypoglycemic, because many times they can bottom out. Like in this heat, a diabetic patient could really have trouble. So when they're out and about and they get hypoglycemic, they should carry something that's gonna help bring that blood sugar up. They will know, because we had that slide where we teach them about hypo and hyperglycemia, right? So they are gonna understand the feelings. They may not get to check their blood sugar, but they're going to have an understanding about where they might be, which will then tell them, based on those symptoms, I think I'm low. So I need to have something. These are just some of the types of sources they can have, okay? But we tell them to carry hard candy with them, like the women, put it in your purse, so that you can take something if you're feeling hypoglycemic. Some of you probably get that way. I know I have. If I haven't eaten, like today, I haven't eaten all day, because I've been from class to class, so I won't get to eat till I get home and have dinner probably. I mean, I brought something, but I didn't get to have it. So, sometimes I get a little hypoglycemic and I know my blood sugar is low. And so I need to take in something, so when I go back to the office, I'll have something. But I'm feeling okay right now, don't worry. Don't worry. I'm okay, guys. Now, the A1C, what do you know about the A1C?
2 to 3 months.
Is the A1C for diagnostic purposes, or is it for monitoring, or is it both?
It's both.
It's both, yeah. So a patient should know what their A1, the last A1C was, okay, or is. Okay, it's very, very important. And then this looks at A1C and daily blood glucose, that, because they go hand in hand really. And that's what this is saying, okay? So, what I want you to know is what is the normal from the book, A1C. What's the normal for an A1C? What are we looking at? Oh, that's way. You wanted what?
Under 6.5%?
We say 7, but that's very good. If you average it out, round up, you got it. 7%, we like it to be less than 7%. You see this here? See how as it goes up, it's getting into the red? That's not good. Same thing, blood sugar. It's in the red. If it's in the red, that is not good. Okay. We got that, guys? I'm trying to give you what I think that you need.
Appreciate it.
I'm sorry?
We appreciate it.
Yeah, I'm trying to give you what I think you need in reference to understanding the disease process. Now, if you need to have further pathophys, anatomy, you gotta go back and read, all right? Introduction of self-management. We call it self-management. So you would be teaching your patient how to self-manage their diabetes. Key pieces of diabetes self-management are gonna be those things I mentioned in the very beginning. Blood glucose, you gotta know how to take, you need to even assess, do you have a meter? Do you have a glucose meter? If they don't, what can they do? If they can't afford one,
There's programs that sometimes.
you could get a social worker involved, perhaps through their insurance, they'll be able to obtain one. But if they're able to, go to Walgreens, go to, some of those places I think will allow them to maybe, there's in the community, places where they can go and get their blood sugar taken. Okay, then eating right. They need to eat right. Getting regular exercise. I'm not saying go to the gym. I'm saying regular, what is considered regular exercise?
Walking.
Walking costs nothing. And you start off light. You know, just walk out maybe the block. Not even a block. Just 3-4 houses down and come back. That's starting out light. Okay? And if someone did that every day, Monday through Friday, oh my God, that is significant based on nothing. Okay? Taking their medication. So we said they've got to take their blood sugar, take their insulin based on whatever that is. They need to eat. And then of course, yeah, wanting to get exercise. I should put that in. I should make that number 6. We should make exercise number 6. You gotta check the feet before you exercise. Cause you may not be able to co-exercise. So number 6, guys. Now, there is such a thing as diabetes insipidus. And I threw that in because it's diabetes kind of related. But it relates to water caused by a deficiency of your ADH. What's your ADH? Anti-diuretic hormone, yes. And so it can be induced by any of these elements that I think are linked to diabetes itself. Okay? That's why I kind of bring it up, because a diabetic patient could have kidney problems, they could have other problems that may cause this. Okay? We're doing pretty good. Again, clinical manifestation. Look, they got 2, it consists of 2 of the 3 criticals for diabetes. And then if the patient is dehydrated, look at all these things that are affected. So yes, diabetes insipidus could be considered a complication. Now, here we go with labs. So, diabetes insipidus, this is what it's gonna look like. So when you look at your labs, the specific gravity is gonna be low. This specific gravity might be a little off from what the book says. I may have to change that. Increased sodium, increase in your, what's H and H?
Hemoglobin.
Hemoglobin, and you will see it written that way. That's how doctors will write it. Okay? And then your bond. What's your bond? What's the normal range, I see?
Isn't it 6 to 20?
6 to 20. Okay, good. And then dehydration and hypertonic saline tests can be done in diagnosing diabetes DI. Now, I I put this in for you because I thought would be helpful. The difference between diabetes insipidus and diabetes mellitus, because there's some similarities, but yet they're different, okay? We're almost done, but I'm gonna let you take a break. Now, this is serious. DKA, diabetes ketoacidosis, I mentioned that earlier, as a it's a metabolic problem for your diabetic patients, okay? And then did we not talk about earlier the ketones?
Yes.
Well, this is a reflection of an increase in the ketones. So we have to look at those. And there's, again, it's a breakdown of the fatty acids and the elimination of the amino acids. The two common ketones produced in humans are acetoacetic, I can't even say it right now, and hydrofutrate. So, when we look at these two, then we're looking at insulin deficiency, hyperglycemia, and dehydration. Okay. Sometimes I talk so fast, or I talk so long. At a break, I need to get some water. Okay, so now, if a patient if they have DKA, what does the glucose look like?
Really high.
Very high.
It's really high, okay? And could they go into a coma?
Yes.
Yes, they can. So we need to be diligent in managing that. How do we do that? Okay, it needs to be taken care of within 24 to 48 hours if we don't want the patient to get worse. So these points are key when we're treating the DKA. Correction of the fluid loss in intravenous fluids. They need an IV started right away, and we need to get them fluids. The next thing following that is we need to treat that hyperglycemia, and they needed probably an insulin drip. So these patients would probably, with DKA, would be admitted to the ER. And they're gonna need assistance right away. So we're looking at correcting their electrolyte imbalance, particularly the potassium loss. What's the potassium range?
3.5 to 5.
Very good. I'm gonna keep asking you guys, because that's how you learn it and you solidify it. Correction of the acid, there's an acid-base imbalance. So we need to correct that, okay? And when we talk about acid-base, what are we talking about?
The pH, partial O2, partial CO2, carbohydrate, or bicarbs.
Yes, very good, because we're talking about the balance of the lungs and the kidneys, all right? And then treatment of concurrent infection if present. If they're coming in as a diabetic patient and they already have an infection, we gotta treat that too, so they're gonna be on IV antibiotics. Would you say this person is sick? Yes, they are indeed a sick puppy, okay? And then, this is the website for ADA guidelines. So, this is good, again, teaching your patients where they can go get appropriate information. Any website that has at the end of it .org, .org, or .gov, those are great sites to reference, to refer your patients to, because they're legitimate. We have so much on the internet that we want our patients to learn information that's appropriate to them. But better yet, they really should go to their provider, to ask questions. But if they go to one of these sites, they'll be able to learn as well, okay? Any questions about that? I think that gives you the gist of what I think you need to know in reference to diabetes. You should be able to answer my questions on the test. All right, any other questions? If not, let's let you take your break. Take 10 minutes.
What's the sign?
Yeah, where's this,
Yeah.
where's the